I'm Brian Chalmers. I'm one of the hip and knee surgeons at the Hospital for Special Surgery. I specialize in all forms of hip and knee replacement type of surgeries, including primary or first-time hip and knee replacements, as well as treating complex revision type of hip and knee replacements. I have a special interest and focus in knee revisions for loosening or stiffness or infection. The most common type of patient that I see is a patient with pain, either in a native joint or a replaced joint that has been going on for usually months to years, that significantly affects their quality of life and ability to have the functional goals that they want to for their life. My approach to patients is really to get them back to the function and the types of activities that they really want to do. Some patients have high goals and expectations of going back to skiing or other high-level activities in sports. And some patients just want to walk on a normal day-to-day basis without pain and go on walks for exercise. So I use computer navigation and robotics in a number of the procedures that I do. In a robotic or computer navigated procedure, the surgeon is really in control and making all of the decisions. The robotic or computer navigated device really just helps the surgeon more fine-tune and really place the components in appropriate position and sizing and really optimize the soft tissue balance and make what's already a good operation even better operation. I see patients here at the main campus in Manhattan as well as in Westchester. Really at both locations you have access to not only a beautiful state-of-the-art facility but all of the same imaging modalities, the same access to great nursing care, and a lot of the same surgeons. I think one of the most satisfying parts of my job is seeing patients back after surgery that are doing well. I think that's the most gratifying part, where you can really make an impact on their life and their quality of life in a very meaningful way.